Hi guys, this is John Adamson, the Rehab and Documentation Guru, and today I'm going to answer an email I received from one of my former course attendees, Aaron, and this is the basis of the question. If I'm seeing a patient for 60 minutes total, and during that time the patient does 28 minutes of therapeutic exercise, but they have rest time, and they also are getting instructed in different things. Am I only allowed to bill for 28 minutes? Well, so let me talk first of all about therapeutic rest. So we're exercising patients. They're not in good shape. That's why we're probably getting them. And there's a necessity that periodically they're going to be resting. The question is that skilled time? And my answer would be, well, it depends. Depends on why they're resting. Is it resting because you're going to get another piece of equipment or you're documenting something? Then no, that's not really skilled time. But if they're resting because you need to monitor their response coming down from, let's say, from a cardiopulmonary standpoint or a pain management standpoint, you're monitoring them carefully to make sure that it's safe and effective to progress to further exercises, then that would be skilled time. So there is such a thing as a therapeutic rest, but you need to define it in terms of what are the skills involved in monitoring the patient during the rest period and why you need to utilize that rest period that would make the exercises more safe and effective going forward. As far as the scenario of 28 minutes of exercise billing 60, I guess I would question, what are you doing the training on? What are you educating the patient during the other minutes that they're not therapeutically resting? If you're educating them on exercise parameters for them to safely and effectively do those exercises, then sure, it's billable time. If you're educating them on the use of a device that they're going to need for walking, they're just not walking during that time, but you're doing education on, the use of that device, and you're giving them verbal and visual cueing on how to use that device, then obviously we'd bill under gait training. If you were, doing some ADL retraining and teaching them some compensatory strategies, then you would bill under 97535 for your ADL retraining code. So anyway, it just depends on what you are doing the training on. That'll determine whether or not it's skilled. So anyway, Aaron, I hope that answers your question and maybe a question that other people have. If you have any other questions, please feel free to email me. My email is adamsonenterprises, the number 1, at gmail.com, adamsonenterprises1 at gmail. And you can always leave a comment on one of my videos, which I will see when I log into my channel, and therefore I'll be able to answer accordingly. Anyway, again, this has been John Adamson, the Rehab and Documentation Guru, reminding you to get paid for what you do. Have a great day, everybody, and God bless.